Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau. And today I am here with Sherry Priebe. Thanks so much for joining us, Sherry.
Good morning, Vanessa.
Sherry presented her master's research study of cultural oral habits and oral cancer in Asia and the global risks of oral cancer globally. Additionally, since 2003, Sherry has researched the lifestyle risk habits of the Vietnamese through an annual working visit. Today, we're going to be speaking about her course, Oral Health Risks and Cultural Habits. And Sherry, perhaps you could start us off. I believe this is your most popular course. Maybe you could help us understand why you think it's so popular.
As a dental hygienist, I'm seeing people every day from different walks of life. And the reason why is because people are moving around the globe. They're immigrating, they're migrating to different countries, and we don't have to go outside of our little office anymore to have a cultural experience, really. So when these people are coming to see us, if we are aware of culturally where they're coming from with their oral habits that are socially entrenched in their societies, we can see mucosal lesions that possibly would be affecting their oral health and causing oral cancer. Being aware of these cultural habits from these different countries just leads to an opening conversation of the awareness of oral cancer today.
Yeah, agreed. So important. Now, could you take us deeper into what is covered in the course, more of the detail?
Well, I talk about the trends of oral health around the world. So most of my research was done in Southeast Asia with oral health habits, mainly the betel nut chewing. And what that is it's a betel vine, and then they take the nut from the areca nut palm tree, and they put it all in there with some limestone and put it in their cheek, and they chew it as a cud. And that irritates the tissue and causes carcinogenic products from that nut to go into the tissue and cause lesions of oral cancer. So that is just one product of interesting habits around the world. And then there's some from Asia and Africa and South America. So as I talk during the session about all this, I have videos explaining these products, life experiences that I've actually been there and been able to identify with the people, and even people from North America going to these places and chewing these products and not even knowing that they could all actually be affecting their own oral health. So it's a real eye-opener, and understanding how we can help these people by knowing where they are coming from, helping them with an understanding of how these social habits are affecting their oral health.
So those are cultural risk factors. And then are there other trends or other things that we talk about in the course?
The trends that I'm talking about are that lifestyle risks have happened and changed too, as there's more of an interest about oral, how do we get oral cancer? And then oral sex, we talk about that. We talk about HPV virus and how that's transmitted. And I really make it very open. And it seems like as soon as I start talking about sex, all of a sudden everybody's interest arises. But it's a real issue today. Everybody needs to know this. The lifestyle risks are there, and awareness is sometimes not completely there. So as hygienists, we have this rapport and this connection with our patients. We can actually talk to them about things like that. Also, smokeless tobacco, it's on the rise too. And we need to be aware that this product is around the world and it's causing problems.
Boy, that is really interesting and so important. Now, you're a hygienist. I heard you mention the hygienist. Is this course typically for hygienists?
No, it would not be. that's coming from my point of view, but the whole dental office finds it extremely interesting because we're talking to people every day. The receptionist says to me, Sherry, those videos were so eye-opening to understand where people are coming from. They're answering questions on the phone all day. The dentist is relying upon me as a hygienist to know and to get to know patients and then bring him this information. The dental assistants are going, wow, I had no idea, that was so interesting. And I could stay awake during that whole presentation instead of falling asleep. So it's a really, really wonderful, interesting experience around the world. And yet we're linking it to our day-to-day lives professionally and socially.
I love that you've invited the entire team. As I listen to you, I'm thinking how I have years of working in a medical and dental front office, business office environment. And I know as part of that customer patient experience, we talk to our patients as they come in, especially if they're waiting in the waiting room. We're going to have a conversation of some sort. And so I love that the entire team's involved because I just think we would learn things up front as well as the assistant or whoever involved to be able to share and make sure that we can share that information and make sure the doctor and the hygienist are aware. So we've talked about what's covered in the course. And who's this is really targeted for. Could you give us an idea on the length of the course and the format? What do you find is the sweet spot?
A half day is my favorite because I can keep the energy level up, keep the audience participation. We talk about different going around the globe, really, and the videos on that keep everybody very, very interested. I find that sometimes I can link it to one of my other programs in the afternoon, so I can end up making it a full day. But this part here, I like to have it just really a half a day and of real enjoyment with participation from the audience.
Oh, love that. Is there anything that we haven't touched on that would be important for the event planner to know?
As a segue to take home with them when they leave, I also asked the audience if they would like an actual reference chart of these oral risk habits and products that people are using and the link of what they might be called in their society. It's all called something different. In India, it's called something. In Asia, it's called something different. And so when we're talking to these people from different parts of the world, I actually give a chart for the dental hygienist or the health professional that can be printed on some really nice hard paper, laminated at home, have it in their own operatory that they can refer to, and even ask people, do you know this product? And it helps so that the hygienist or the professional has something right in their hand that they can take home from the presentation.
Oh, I love that. Love that. Well, thank you so much for sharing with us today, Sherry, about your course, Oral Health Risk and Cultural Habits. And for the event planner who would like to find out more about bringing Sherry to speak for their meeting on this topic or one of her other topics, you can find out about all of her courses at dentalspeakersbureau.com. You'll find her contact information there for Sherry Priebe, as well as you could email me info at Dental Speakers Bureau. I almost didn't get that out. Info at dentalspeakersbureau.com. We'd be happy to help connect you. So again, thank you for tuning in, and until next time, be well.